Hi, I'm Mary Xiong. I use she, her pronouns, and I am the Vaccine Outreach Director at the Minnesota Department of Health. Healthcare access is so crucial in our big part of public health, and that means being able to access resources, going to get information, or getting the services that you need from providers or from specialists or from experts who would be able to help you in your overall health or support. Being able to have this conversation about understanding access allows us to understand the history and the improvements that we need to continue to do to improve different communities' health and well-being. That means being able to access the health insurance that they need, being able to access the healthcare services that they need to have for themselves or their children, so they could continue to have a positive and well-dignified life. There are still a lot of barriers and disparities. Even though one community has been able to strive and access the needs that they want, there are other communities that are still very disproportionately affected by the different outcomes of the pandemic or other health issues. Even though we are a variety of different groups and ethnicities within a larger racial group, we can still identify with the same technology barriers or the same different challenges to access. And so finding those common grounds really helps support us in strategizing what would work with the overall racial groups, and then what would be the most specific down to ethnicity groups. Over the pandemic, we really saw the changes in the dynamic of just healthcare overall. And we were able to see that different communities were impacted very differently through different financial hardships or just different healthcare services resource as well. And from this, we learned some really crucial lessons that really shaped what we really need to do to step up with our healthcare and public health for the populations that we work with.